eventually, if I don't take care of myself, if I'm not fucking eating bananas and I ain't working out and I'm not fucking meditating or drinking water, like, I don't know what will happen to me, right? And Black women, Black people, Black trans people, Black queer people has taken on this labor so much and put their health behind themselves, because Black liberation is so beautiful, right? It's for our children. And the stress of that alone, I know it damages me.
You bougie bitches scare me. And if you don't get it together and drop these macho attitudes, you are never gonna have anybody bringing you anything, anywhere, any place, anytime.
Mr. Vice President, I'm speaking. I'm speaking.
All of you jealous, ugly bitches, get kissed by fabulous, very perfect Black ass. And yes, William, today, you're one of those bitches.
Hey everyone, and welcome back to the Barely Adulting Podcast, where we discuss news, relationships, pop culture, life issues, and so much more. I'm your host, T. Marie. Now, if you have not done so already, go ahead and like, subscribe, share, and download the podcast. And if you're listening on Apple Podcasts, go ahead and leave a 5-star rating and a review. Thank you to everyone who is tuning in today, including the new guests and also the ones who have been riding with me since day one. I appreciate you all. Now, we are going to do something new this week. We're not going to do our morning coffee segment, unfortunately. However, we will be talking about something that's near and dear to my heart, Black History Month, because it's February. Why not, right? So I'm going to talk a little bit about that, and then we'll get into our grown folks table talk and get on with the show. Now, as far as Black History Month, it was formerly known as Negro History Week, and it celebrates the contributions Black Americans have had or have made in the United States. Other countries like Canada and the United Kingdom also celebrate this month as well. Or I know one of them celebrates in October, but they do celebrate the contributions. We celebrate people like George Washington Carver, an agricultural scientist and inventor who promoted alternative crops to cotton and methods to prevent soil depletion. Madam C.J. Walker, the first self-made millionaire by creating her own hair care products after suffering from hair loss herself. And others who we typically don't hear much about, like Elijah McCoy, who held 57 patents from his many inventions and being known for inventing an automatic lubricator that was used on trains. Or Esther, Baby Esther, Jones, a popular Cotton Club singer and child entertainer in the early 1900s, who coined the phrase boop boop a doop, which actually led to the inspiration of the 1930s cartoon character Betty Boop. Now, there are so many people we can give their roses to, from abolitionists to authors, teachers and doctors, entertainers, influencers, you name it. Even though we have all year round to do this, I do want to send a special thank you to all of you, no matter how big or how small your impact was or can be. Now, hopefully this inspired you to go ahead and look some people up, even if you're going into a dark hole with this Google search. Try searching people like Sarah Boone. She's actually the inventor of the now improved ironing board that we use in our daily lives. She improved this in 1892. Or what about Mary Van Britten Brown? She actually invented the home security system in 1966, just because she felt unsafe at home by herself when her husband was away, and the crime rate was skyrocketing in her neighborhood, and a lot of times the cops didn't come and see about her because of the area that she was in. So she just figured that she was gonna make a home security system, and this is the basis of a lot of home security systems that we use today. You can look up Garrett A. Morgan. He improved the sewing machine and also the gas mask, but he was really known for inventing the 3-light traffic light, because one day, him being the first Black person in Cleveland to own a car, he witnessed an accident on the road, which was very severe. And he thought to himself, like, hey, why not have a signal that lets other people know that it's about to turn red, or, instead of just going from green to red. He added to the invention and created the 3-light system, which added the yellow yield sign as well. So it's so many other people that we can name, like the inventor of the automatic elevator doors, Alexander Miles, or even the refrigerated trucks that was highly used in World War II to preserve blood, food, and supplies for the war, and is still used to this day. Frederick McKinley Jones, because his company is Thermo King, which is one of the most popular refrigerator trucks there is. He invented that. So it's so many people that have made contributions to America, to the world, I guess you could say, because we use these things in everyday lives and we just don't think about it when we are using it, because it's almost like second nature, right? So let's go ahead and give those flowers to those people while we can. Go down the rabbit hole. Go ahead and find some people and find some new information out. It's actually a really great search when you start to learn more and more things, and the more contributions that Black people have made, and ultimately made life better for us in a sense. But anyway, I just wanted to talk a little bit about that. We're probably going to go ahead and talk more about that later down the line in our later episodes in February. Probably gonna throw some stuff out there and all throughout the year, let's be real. But now let me tell you all this. I know it is Super Bowl Sunday. I totally forgot about Super Bowl Sunday, to be honest. I didn't even know the Super Bowl was today until Saturday, which was yesterday. So, I mean, my team is out of the car. I mean, it really doesn't matter. My team been out for a while now. Yes, I am a Chicago Bears fan. Sorry, not sorry, but really am sorry because, they disappoint me all the time. Yeah. I don't want to be, no, they just disappoint me all the time. And even when they were, looking like they'll do something, no, never at all. So it is what it is. I didn't pay attention to the Super Bowl coming, so hopefully y'all go ahead and stay safe. I know that people are still making Super Bowl plans and things of that nature, the ones who have been watching the game, right? And the ones who are in Tampa right now. But just continue to wear your mask, social distance and things of that nature, just to help out and help your neighbor, even if you don't believe in, I guess, the coronavirus in general. For whatever reason, that's your prerogative, honestly, at the end of the day. But if you do care, or if you could care, just go ahead and wear your mask. It's not that big of a deal. Just help out the next person and be considerate. That's all we can do. But let's go ahead and switch topics and get into our Grown Folks Table Talk. I do have another special guest on the show, so stay tuned for that. Let's get into it. I have another special guest with me this week. Could you please introduce yourself, Katie?
Hello, everyone. My name is Inez White, and I also go by Kitty. I am a medical professional. I've been a registered nurse for about a year and a half. In total, I've been a nurse for 8.5 years. I'm also an organizer, abolitionist, and I'm currently a DNP FNP candidate to get my degree in family nurse practice, and my focus is primarily health disparities in the Black community and how to address those disparities. At this time, I'm currently looking to address them. Address them with education.
Okay. So, how are you doing today? I just want to go ahead and do a little check-in for you, real quick.
So I'm doing okay. So I work at nighttime, y'all, and so I basically got off work and I slept in my car for a couple of hours because I do local travel, and it's like an hour drive. And if I'm tired, I go to sleep before I drive. And I had my first waxing appointment for a Brazilian wax,
Oh,
and I almost cried.
oh,
So that's where I'm coming from right now. So yeah, I mean my it's nice and smooth and all of that,
yeah.
but that it hurt. So
I
yeah.
know. I had it done for the first time a couple probably like a month ago, and I told myself never again. Yeah.
Yeah, I feel
And
like, I don't think it's that important. I don't even care. Honestly, I just wanted to try something different, but yeah, I don't know.
no, same because I was like, you know what? I keep hearing about it. I hear it's great, but I also hear that
Yeah,
it may be.
right.
And so I was like, you know
Right.
what? Let me get it out the way and let it take my virginity, and I will never do that
Yeah.
again because the lady that did it, she the entire time I'm sorry, like every time just
Ooh. He just kept
repeat.
doing it. And you
Yeah.
had strips? Did you have strips?
Yes, I had strips.
See, they told me, so I tried it one, like I got two chances, that's all. I
Hmm.
tried it with the strips. My friend said, okay, don't do the strips because the strips it's about 20 times that
Yeah.
they pull in.
Yes.
But if she said if I do a hard wax, they only do it like 10 times. And there's no strips. So we're gonna try that next. It's the European wax. After that, it's over with. We're gonna go back to the razor and the baby oil. And it ain't even that often. So it's okay.
I get that because it's supposed to be just every so often. Okay, that's the good thing about it. You
Right.
can stay,
Mm-hmm.
waxed up and you're fine. But I went
Mm-hmm.
back to razor. I'm fine. I'm fine with that. I told like I'm not gonna
Yeah.
knock it at all because I'd rather not go through that much pain just for that.
Lord have mercy. Exactly. I was just like, woo.
Yes,
Yeah.
I try not to cry.
Okay. So that's me. Yes, I was really close to crying. I was really close to crying, and she was making me laugh, and she was good. But baby, mm-mm. So yeah, that's how I'm doing.
Okay, well, I'm glad that you're doing better than what you were before because
Yeah. Yeah.
all this pain that we got to go through just as women is ridiculous. That's no,
Yeah. I ain't gotta go through it. Damn.
I ain't doing that.
I'm gonna be good with that raise.
No, but for real. Okay, so after our conversation, I know that we talked about your position as a medical surgical nurse, and I'm pretty sure some people in the audience may not know what that entails or what that is. Could you actually go into detail of your, an explanation of that?
Yeah, so medical surgical nurses. So I'm a med surg tele nurse. Medical surgical is honestly it's just a generalist, which means I see mostly all patients. Right? It's not cancer. It's not labor and delivery. It's not neuro. However, it's still all of those things because I still get patients with cancer. I still get patients who had a baby and came back with they may still have some bleeding or something like that hasn't been resolved, or they had a miscarriage and they may come to my unit, or they had a stroke and they maybe the neuro unit flooded or not flooded, but had an overflow. So yeah, for medical surgical, and then tele just means that some of my patients may be on a heart monitor, and then there's a remote tele, so someone monitors them from another room and just updates me for abnormalities. But yeah, so I see all types of patients, operative patients, um, yeah, yeah, dialysis patients, cardiac drip patients, just everything. Honestly.
And I know that there's been a lot of things in the news, or a lot of times where we'll see a woman or a man who's getting on social media and saying like, hey, I don't know what this is. I don't know what I'm taking. The nurse or the doctor didn't explain this to me. And all of a sudden, I'm not sure if you saw that video of the black doctor, right?
Mm-hmm.
It was a black doctor
No.
that had COVID, and she ended up
Mm-hmm.
passing away because of her staff or whatever not actually caring about
Oh,
her.
I did see that. I did see that.
Right. And it was kind of frustrating to me to see because I know she's actually a black doctor and her treatment was looked at as if she was just a nobody or whatever. And honestly, we see that time and time again, especially with Black women. We are getting to a point where they're not getting as much sympathy or empathy when it comes to their health. Do you typically see that when you are working in your field? Like, do you see your coworkers not giving as much care to certain patients than others?
So when I worked at the hospital that I was previously at, it was predominantly Black hospital, and I definitely saw that. I post all the time about me loving Black women and loving my experiences with them as my patients, because I see it all the time when, and not even just women, Black people. I see it all the time when they're not listened to.
So I had a patient, it was a male patient, and he basically he had peptic ulcers, and the way that he was describing the pain was like fire in his stomach. And I gave him education. We talked about his routines, his habits. He drank alcohol, and things like that. So we talked about, like what to change and things like that. And it got to a point, and I was precepting. So I was his nurse, but I was like orientating. I had just started at that job. So I had another nurse that I was shadowing. So I was still in the room with him by myself. But long story short, it got to a point where he was crying. He was on the floor, and he was like banging on the floor. And this is like a young Black man. He's like 32, anywhere between 32 and 35. And he got tattoos, and like he on the floor crying, fetal position, banging on the floor. And we giving him the medicine, but he can have more medicine. So I called the physician. I let him know, like, hey, this patient is in excruciating pain. He's saying it feels like fire in his stomach, and he really just needs some pain medicine. And he was like, no, he doesn't need any medicine. We're already giving him morphine. He's just drug seeking. I'm gonna discontinue his medicine. So he actually decided to discontinue his medicine that he had to give him nothing, because he said he was drug seeking. So this was like one of my first experiences at this hospital. And the person I was shadowing was a white nurse. She was not even in the room. She just didn't seem like she cared at all. She wasn't even checking on him. I was shadowing, but it's still your patient. So I went ahead and I told her, like, he's not trying to give him anything. She was like, well, and there was a previous incident where they called security on him just because he didn't like the fact that he had a roommate. He was like, you're sharing my personal information, you're talking to me, and I have a roommate. Like, I don't want a roommate. That's like the violation of HIPAA. They're sitting right there, So they called security on him. So this is already like a big thing. So anyways, I had to call the GI physician, which is the gastrointestinal, because they have many doctors. They may have an attending, which is their primary doctor, but they have a consultation, which is like a specialist. And because he had a peptic ulcer, he had a gastrointestinal doctor. So I called him. This is a Black man, and I said, hey, look, my man on the floor, he crying, he's screaming. I told the other doctor he ain't trying to hear it. He won't give me no medicine. I'm like, please, could you just give me something? He's like, yeah, he asked me questions and stuff. So he's like, yeah, give him, increase it to this. And that's how I got his medicine. I had to call the Black doctor and talk to him. He was cool. And I had another instance where I had a Black woman, and she long story short, her renal function was poor. She came into the hospital, it wasn't poor. There's a thing called acute kidney injury, and you can get it from infection, you can get it from shock, you can get it from medications. And she was on water pill. It's Lasix. It goes to the IV, and it's called nephrotoxic, means it can damage the kidneys. So her levels were getting worse. And I always look at labs and I always discuss them. And I told her, like, hey, do you know your GFR is low, your creatinine is high? Do you know anything about this? Have the nephrologist talk to you? Because that's the kidney doctor and he's on her case. And she was like, yeah, but he just told me my kidneys are a little junky, but they're not too bad. And I was like, well, I'm not the physician, but I'm gonna be honest with you. Your kidneys, like, that's not just a little junky. The values are cut in half. And, obviously it's acute, but it can become chronic if it's not fixed. And it's been a few days, actually, and when you came in, your kidneys weren't looking like this. So long story short, I printed her out education the same way I do everything else. I made sure I didn't tell her a diagnosis that was not given to her by a physician. The diagnosis was written in the physician's note. Everybody was talking about the patient besides to the patient. You know, everybody except for the patient was talking about the patient. So, you know, they're all in the chart like, oh, I wonder if she has a history of chronic kidney disease and maybe we just didn't know it, or, you know, does he, whatever, but not having this conversation with her. So I print out the information and then I go ahead and I give her my spiel. I talk to Black women different than I talk to anybody else. Black women and black people, Black women, black men, Black non-binary people, all Black people. I talk to them different. Like, I'm coming to you because I love you like I love myself, and I'm gonna give you this information straight up. You know what I'm saying? And I'm not gonna tell you nothing that I feel like is wrong. Obviously, I don't give diagnosis because I cannot, because I'm not a physician. However, if you have the diagnosis, I'm going to educate you. And so I gave her the most education I could. I stayed in her room for an hour. We talked about her comorbidities, hypertension, diabetes, obesity, paired with the now acute kidney injury. And I was just telling her, like, you know, hey, you know, you don't only have one thing working against you. There are 4 things. And I know they ain't tell you, and I know this ain't your fault. It's nothing that you did, but we can do something now, right? And so we talked, she cried, you know. The next day I told her, talk to your nephrologist. He'll give you more information, which is the kidney physician. You know, she talked to him the next day. He came in the room. He threw my education on the floor. He told her, don't listen to me. And what he said was, your kidney function isn't that bad. You know, it's a little bad, but it's not that bad. He ripped up the paper. Mind you, this is his diagnosis. His diagnosis was renal insufficiency, right? I can see that. I can see that that's the diagnosis based on the labs, but I also cannot diagnose, right? So I can't give you a diagnosis that the physician didn't give you. Mm-hmm. He wrote it in his notes. That was the diagnosis.
So did he know who the patient was prior to giving that diagnosis?
Yeah, he knew who she was. He had already spoken to her earlier.
So what was the point of ripping up everything? I'm sorry.
What he said was, he basically, I guess he was trying to indicate that I was exaggerating how bad her kidney injury was. And I told, you know, I didn't speak to him because I didn't see him, but I told her, look, I'm not going to tell you anything that I wouldn't tell my mom, my sister, my brother. That is not good. Her GFR was cut in half. And like I said before, acute injury is acute and it can be acute, but acute injury can turn into chronic kidney injury in a hospital stay. It's chronic now. If it doesn't go back, then it's not reversible eventually, right? So what happened was, I guess he was trying to say I was exaggerating, right? But what he said was the killer part. He said, your kidneys aren't that bad. Don't listen to her. He threw it away. And what he said was, but you don't need dialysis now, but maybe in 10 years. How old do you think she is, Tia? How old do you think the woman was?
I have no idea. What was she, 20, 30?
She was 30. She was 35. So this is a 35-year-old woman who has comorbidities, meaning multiple different diseases that joined together can do a lot of damage. Hypertension, diabetes, obesity. She had like spinal herniated disc. I mean, that didn't have anything to do with nothing, but all of those things. Now she has acute kidney injury, right? And she had like a GI issue. I think that's why she was on antibiotics. I can't remember what the GI issue was. So you're telling me that you're going to tell a 35-year-old woman that in 10 years she's going to need dialysis, right? Kidney failure is not a normal happening. Everybody doesn't get kidney failure just because they get older. So that's not anything to be like, oh, when you get 45, you're gonna have to go to dialysis 3 times a week, and you're gonna have to require a machine to clean your blood and filter it and put it back in you. That's not normal.
Correct me if I'm wrong. Like, if you're in your 30s, your body should be able to handle certain things, right? And it should be able to like heal itself in a certain way. So at this age, you would assume she's not 50, she's not 60 or whatever. You know, her health is not going down that way, right? Because of age. Don't you think that stopping it now would like prevent that whole dialysis thing 10 years down the line, or at least doing something about it?
That was my point. And so that's why we ended up crying. And I just told her, like, I gave her my information. I said, look, I don't trust him. He don't care about you. He wasn't a white doctor. He was a doctor of color. He was like South Asian. And, you know, I was just like, he don't care about you. You know, I love you. I love you like I love myself, and I'm gonna tell you the truth. And you know what you said, Tia, you know, health isn't always correlated with age, right? So even if you get older, one thing that's gonna get older is your heart. Your heart gets older. Every organ in your body does age, right? Eventually, if you're 100, you might have heart failure, you know, because your heart is gonna eventually stop working. But not everybody gets kidney disease. Not everybody gets, all of those things aren't correlated with age, right? They are more so correlated with, they can be correlated with genetics. They can be correlated with lifestyle. They can be correlated with the medications that you take. All of those things play a role in your health. But the fact that she was 35 and she had all these comorbidities is what put her at higher risk. And so what I was saying, referring to her age, was that you don't tell a 35-year-old in 10 years you're going to have dialysis, because her kidney failure was not, it wasn't like a genetic, it wasn't like a childhood kidney disease, right? Where there's nothing that you can do to change that usually. It's kind of like an autoimmune if your kidney's attacking itself, or it's not anything. It's not like over time you had high blood pressure and then your high blood pressure damaged your vessels in your kidneys, and over time they got worse. You know, her case was due to all of her comorbidities, and all the medicine she was taking caused her kidney damage, right? So what I was saying was those are things that can be modifiable. Some people have kidney disease from a young age and it's not modifiable. Hers was modifiable. And so to me, that's not something that you tell someone, you know, this is just what your fate is, because it doesn't have to be that way. So, yeah.
So I heard you say a couple things, and I'm going to go one by one, of course, because I want to bring up the drug seeking portion of what you said, minimalizing sickness, and the fact that they call security on this one man. But I want to go back to the drug seeking, right? When they say drug seeking, we automatically think that this person is prior to actually seeing this person, you already think they're on drugs.
Yep.
Do you typically see that in other patients outside of Black patients? When I say that, I mean from your nursing staff, from your doctor staff. Like, do they automatically think, oh, well, that person is doing too much, so they must just want the drugs type of thing? Or do you see that more so in the Black patients? Like, even if it's like in the back of their head, they're not really thinking about it, but it just comes off as that, if that makes sense.
Yeah, you mean like covert racism, not over. So 100%, yeah. So the hospital I worked in, like I said, was in a predominantly Black neighborhood, and a lot of our patients were Black, and yeah, that's who they were talking about. When I had old white women who had chronic pain, and they could have been in their 80s or 70s, or they could have been in their 50s with chronic pain, and they look as if they're high, like off of heroin, honestly. And this is no shade. This is honestly, and I'm giving them more pain medicine. I'm not judging them, but that person isn't pain seeking. The person who's nodding off is not pain seeking, and you know, or drug seeking. So anyways, it's definitely racist. It's definitely racist. And what's funny is I went to a hospital on the north side, because I travel now, I do local travel. And on the north side, it's a bunch of different ethnicities, a lot of immigrants, a lot of different people. There are less Black people at this hospital than at my last hospital. The last hospital was probably like 80% Black. This hospital was probably like 10% Black.
And she's talking about Chicago, just to let y'all know, north side of Chicago.
Right. And this is a north suburb. Both of these are suburbs, north and south suburbs of Chicago. So the north. So anyways, the patient, I remember I was getting a report, and I was like, where's his pain? Because the patient was a paraplegic, meaning that the bottom half of his body was paralyzed. Usually when you're paralyzed, you can't feel anything, but sometimes they'll say like they feel like tingling or some type of sensations, neuropathic pain that they can still feel. So when I was getting a report, I asked the nurse, okay, where's his pain at? You know, because he's getting this pain medicine and he's paralyzed. It could be up in his upper body. She didn't even answer. She said, oh, I don't know where his pain is, but he has a history of drug abuse. So what she was inferring was that he was asking for pain medicine because he's a drug addict, and it didn't matter where his pain was at because he probably doesn't have any pain, right? Okay. So I didn't, and I was mad at myself because I usually snap. I usually correct you real fast. But so I be just trying to, sometimes I just can't all the time just snap off because they don't have a bad day, whatever. So I'm like, I let her go. I went in the room, like I talked to everybody else. It don't matter who you are. I'm going to come in with the same energy. Hey, how you doing? My name is Inez. We was in there for a minute. I talked to him about how he became paralyzed. I usually talk to them for a long time. And, do you know the entire night, he did not get one pain pill from me? Not one pain pill. He didn't ask for a pain pill. I asked him, hey, where's your pain at? He described the pain, which is what she was supposed to ask. He described the pain. He said what it felt like. He characterized it. He rated it for me. I think, let me take that back. I think I gave him, I didn't give him any extra pain medicine. Everything that he had was scheduled. I gave him muscle relaxer. That's not a narcotic. Mm-hmm. It was scheduled, and I didn't have to give him any additional pain medicine. And so that was bullshit. It was racist. You're stereotyping somebody. I don't even like the fact that people put drug abuse in your history because you're automatically going to be like drug abuse. And the physician is automatically not going to want to prescribe you medicine for pain.
But just because you have like drug abuse in your history, does that mean that pain goes away? That's
doesn't.
Not the issue.
No, but their belief is that you are going to be, once you get the medication, you're going to be drug seeking, and you're going to keep increasing and increasing, and they're not going to do it. And the reality is people do have issues. People do have drug related issues. But the way that physicians and staff act is racist. They are stereotyping people 100%. Just like when they use the term non-compliant, they do it a lot for people, especially poor people, especially Black people. And they don't even ask why. I'm telling you, I'm usually in the patient's room for a long time. Not because it takes that long to do what I need to do. I'm doing a few tasks. It's because I'm talking to them. Mm-hmm. I know that they didn't refill their inhaler because he told me if he did 3 pumps, or 2 pumps 3 times a day, he gonna run out, and insurance is not covering it.
Right.
You know what I'm saying? He said, oh, they changed the medication, but it wasn't time to get a new prescription or whatever the case may be. A lot of times it's insurance validation, or it's insurance authorization, or it's transportation, or it's I just didn't have time to go get it, or I didn't understand the significance. Putting people off as non-compliant doesn't address why they weren't able to do what they needed to do for themselves. And that's what I'm so passionate about in my practice, is making sure that I meet people's needs and I assess barriers, and I'm seeing what they need, right? I'm doing assessments, and I see, oh, you don't have a car. Like, how are you going to get your medicine? Or you're an elderly person who doesn't have a car. How do you get to your doctor's appointments? Does someone take you? Do you have pay set up? Like, how are you paying for your medication? People, and I understand they're not caseworkers, but you have to do the diligence of this profession. As a holistic provider, you need to interact interprofessionally with different members of the healthcare team. If you need to talk to a case manager, then you need to talk to them. You know what I mean? And they're not really putting a lot of emphasis on anything social related. They're just like, oh, this is the issue. And a lot of times, another big issue that I have with physicians is just like that physician didn't talk to my patient about her renal insufficiency, not good enough for me to be, because I knew that she didn't think that it was serious because of the way she was acting. She just was just like, nothing had come over her, and I sat down and I talked to her and I said, hey, do you know that your kidney function is getting worse? And I said, I know that it's acute. I know when you came in here, you didn't have it, and it can very well go back, but you have a lot of things stacked against you. You have 3 comorbidities stacked against you: diabetes, hypertension, and obesity. Diabetes, it damages microvascular system, so the small vessels, because of the increased sugar, damages your vessels. Hypertension and blood pressure it's a hormonal aspect in your body, patho or physiology, and where your blood pressure is a response to hormones, and the kidneys is a part of that, the entire structure. So if you have hypertension, eventually your kidneys are being damaged. You know what I mean? So you have all of these different issues coming at you different ways. So I'm trying to explain to her the severity, and I just wanted to know, do you know? You know what I mean?
Right.
And so I'm knowing that they're not taking the time and they're not caring enough. And I don't want to see a person at all, but especially a Black person sitting in bed, and here they are on Facebook or whatever, and I'm seeing them, and I always think about this when I'm on Facebook. I'm seeing them interact with people. I'm seeing them laugh. I'm seeing them share memes, and I'm looking at their lab values at the same time, and I'm just like, this isn't like, do you know how severe this is? And it just came over me one day when one of my sisters, her cousin, passed away from kidney failure, and he was in his 30s. And another man that I knew through someone else, I didn't know the man, but I knew he was young, and he died from kidney failure. And a lot of times things are preventable. You know, I told you that sometimes kidney disease is not modifiable. You know, some people have kidney disease from a young age, and it's not anything that they did. And I don't want to keep saying they did, right? Because I don't like the individualistic approach to healthcare in America, where it's like, you did. No, the system is fucked up, and it puts us in places where we don't have the access to resources or the education to what we need to get what we need, right? We don't use herbs because we don't know what herbs to use, right? We don't know what healthy ways to do things, how to prevent disease before it comes, because we weren't taught all of these things. And just saying working out and eating healthy is not enough. Niggas be stressed out. The stress of being Black in America is enough to cause damage, right? It's called withering theory. And it's enough to put enough stress in your body to cause disease, if it doesn't cause disease, it ages your body. You know what I'm saying? So that alone is enough to be fucked up. So I don't like to put individualistic, things on people. But, and when I'm at work and I see my patients and they're so young and they're vibrant, right? They living their life, they partying, they doing what they supposed to do. And I'm looking at they labs, and I'm looking at their vitals, and I'm just like, this ain't good. Like, this not good. And I don't think they understand the severity of how bad it is, because nobody is trying to explain to them, because they think they don't care. They think they're not compliant. They think they want to live like this. Like, no,
But you
nobody
also
want to live like that.
add on to the fact that we have a history as Black people to take on a lot. We have a history of taking on a lot, but still pushing through, still laughing through the pain, still smiling and everything else. And I feel like that is a part in our demise, because even if we are in pain, even if we're going through something, we put on this cloak where we're saying, oh, we're okay. And it minimalizes our pain that we're going through. And you actually touched on a lot of topics, the barriers and things of that nature, that I was going to ask you about too. So I'm glad that we went over it. But do you feel like mental health or mental illnesses have a effect on your physical? Because I know you kind of talked on it a little bit. And why do you feel that way, and everything else, for people that may not know certain things about mental health and physical health and how that has a correlation to both?
I know, just so for instance, touching on like what you just said, Tia, the woman that I was speaking to, she was a mother, and I think she had 3 children. She had a baby that was 3. And I was just like, she was so strong. She was so strong. And we was in there, we was crying. And that's why I'm getting emotional now. We was crying. I was just like, you got a baby that's 3, sis. You got a baby that's 3. You got so much to live for. And we gonna get through it. Whatever questions you have, please ask me. And if I don't know it, and that's one thing about me, I don't know everything, and I will never know everything. I will never know everything, and no one would ever know everything. But if I don't know, I'm gonna find it out. And if I don't, if I can't find it out, I'm gonna ask somebody that knows.
Right.
Because I want you to know. I want you to have the information. The same way I'm gonna dig down. If it's my daddy, my sister, my grandma, I want you to know this information. You know what I'm saying? And so, like you said, strong, right? She was strong. She was so strong. She had to hold together a lot. You know what I'm saying? She was a single parent. She had 3 children. She looked so beautiful from the outside, and I just meant like her spirit was beautiful. She is beautiful in every way. You know what I'm saying? And so, yeah, that is stressful. That's stressful. And so, what I mean by the mental health portion of things, taking a look at it in a few different ways. So, for one, when I don't feel good, I don't do good. When I'm not grounded, I don't do good. Right? Just the difference of me waking up and lighting a candle, writing in my journal, having quiet, having still space, quiet time makes a difference in how I feel in the day. And it's good for me, and I'm sure it's good for anybody else to just be grounded. And I think that we don't talk about that in the Black community a lot. We don't even notice it's an issue.
Right.
When we say like, oh, we work up on the side of the bed, it is a drastic difference for me. When I have the time to ground myself, I respond differently to my child. I respond differently to other people. And my internal health, like my internal response to things, I have anxiety. And if I don't ground myself, I'm like constantly like in my head. Even if I look calm on the outside, I'm thinking of like the million different things that I have to do. And it's just overwhelming. And sometimes all of that work and all the labor and everything that we have going up that we have to endure, it weighs on us, right? Mm-hmm. And that's one thing, right? That's just like daily health and daily mental health. You know, wake up, you know, eat good, drink your water, like spend time with yourself. Like if you can, if that's an option for you. And that's another thing you have to remember. People don't have the same luxuries, right? I know I have privileges, right? I know I can afford to have a homeschool, my comrade come to homeschool my son, which gives me time to go run my errands and clean my house and do my homework. And people are not afforded that same luxury. You know what I'm saying? I have time to where I can my son's father can come and pick him up and take him somewhere to where I don't have to use the time to travel, and I can meditate before I go to work, or I can sit in the tub before I go to work. All of those little times are so much, they do so much for me. I can go crazy if I don't get that, right? So imagine somebody who don't have none of that. And that's directly correlated to privilege too. It's correlated to access also. You know what I'm saying? And it's just like, it's fucked up. It's fucked up. It's fucked up because, you know, I need my time to myself. And if I was somebody else who probably didn't have as much money as I have, or as many people in my village to help me, then I would probably go crazy, you know. And at a point, I had postpartum depression, right? When I was poor in college, when I did have a village, but I was alone. I was still by myself. I had a village. They helped me. It was great, but I still had my baby crying on my breast while I'm trying to read a book, you know. So imagine that with a woman who has, or a person who has, you know, however many kids, 1 to 5 kids, 1 to however many kids you have, and you don't have support, and you don't have money, and you don't have healthy food, and you're trying to tell them, go ahead and eat this healthy food and go fucking work out. I just got done cleaning this house, yelling at 1 to however many kids I have. I didn't get off work, a laborious job that don't pay me shit, and you want to tell me to eat right and exercise? And
at the same time, you might not even have like accessible food. You know, some people have food deserts and everything else where you can't.
Do I have a car? Do I have a car?
You have to get on the bus. You gotta wait for that.
Exactly. So that's what I'm telling you. That is what my passion is, because all of these things are interrelated, right? Stress, mental health, all of that, right? I can't go in my room and be ignorant to the fact that they don't have, not all of them, right? Some of them, and I'm not stereotyping or characterizing a group of people. Some of my patients who are underprivileged, I cannot be ignorant to the fact that they are underprivileged. I can't go in there and say, girl, go take a yoga class. Girl, go get this expensive ass mother vitamins from the store and this expensive ass health food shit that you, girl,
That's
I'm trying
probably
to
in
make food for
Orland
my
Park or on the
kids.
north side of Chicago versus being on the south side where it's more Black and
So
brown
different.
communities.
So
You
different.
know,
So different. And then what helpful, I did a community assessment. I live in Morgan Park, and I drove around here and I couldn't find it. Then it on the website said 7 grocery stores. I found 4, and one of them was a damn corner store. So and then it's like, if I didn't have a car, was I gonna walk there? Obviously I would, but it's like, it's like a mile. One is like a mile, one is like 2 miles, one here, one there, whatever. But and that, so that's on one part of the mental health, right? That's on the fact that you can't even access the mental health needs that you have because of everything else that's going on in society, that all the barriers stacked against you. On the other hand, what damage is this doing to your body, right?
right?
And I think about this all the time, right? And I said that I'm an organizer and I'm abolitionist, which means that I don't utilize the police, and I don't because of their role in harm and state violence, but also because of the reasons why they were originated in America, was to catch slaves,
Right.
and they continue to disproportionately negatively affect Black people, Black and brown people, and they're a money making machine,
Right.
and it takes away so much from so many things that we need. What we need: school, what we need, mental health. There's no place for me to send my brother who is mentally ill because we got so many fucking prisons.
Yeah, because I make money off of it.
I send my brother to a place for treatment, but he can go to jail though.
Yeah, definitely.
And he'll get all the shit he needs. Like not in great quality though.
But even then, the prison system is supposed to like help out those people who are in prison. It's supposed to be a rehabilitation center because that's where it is everywhere else in the country, but not in the country, outside of this country.
Outside of the country, right. And so and as an abolitionist, right, you always hit roadblocks, right? As an abolitionist, we always have to imagine the world, and we always have to work to make the world how we want it to be, right? Because we are reimagining this world. We are reimagining a world without a carceral system, and so that in itself is stressful. Seeing, and a lot of people say, like, I'm an organizer. A lot of people say, like, oh, y'all don't organize about Black on Black crime. Baby, that shit hurts. That shit hurts so bad because me as an abolitionist, I'm organizing to dismantle the systems that puts us in the places to where we are participating in that crime because of our poverty, because of our situation, because of our circumstances, because of our lack of access, because of our fucking lack of mental health resources. I'm organizing to dismantle all that shit. And it's and the reason why we do that is because it's a domino effect. Once you fix structural issues, everything else follows. But people think that because I'm not saying, oh, so-and-so got killed, it hurt me so bad, that means that I don't care. I cry every day. That is my mental health. That's withering theory. Withering theory is when you take on all of the issues in the world, like all of these issues in America. As a Black person, you take on, I'm a mental health professional. I take on all of the work and the labor to advocate for my patients, to empower my patients and to educate them. I take on the labor of organizing and educating people about change and about the carceral system, about hyper-capitalist systems that don't help Black people, and trying to reimagine the world and trying to logistically make it happen, countering systems, continuously arguing with people, who want police. That is labor, and that shit is stressful. That is what withering theory is. Eventually, if I don't take care of myself, if I'm not fucking eating bananas and I ain't working out and I'm not fucking meditating or drinking water, like, I don't know what would happen to me, right? And Black women, Black people, Black trans people, Black queer people has taken on this labor so much and put their health behind themselves, because Black liberation is so beautiful, right? It's for our children. And the stress of that alone, I know it damages me, right? And that's the theory. Y'all can look it up. Y'all can learn about it. And one of the things is that, you know, we keep looking at, why is it that Black women are dying at disproportionate rates after birth, right? And so they looked at, you know, I was always taught money and access will give you everything that you needed, right? So I thought, get an education, get money. And so that's when my lens changed from individual to more of like a socialist, more, I'm all about community now. And I was so go get this money, go get this, because that's what I was taught. That's how Black people get out, right? What about all the other Black people? What about all of them that's still there?
But even then, you got people like Serena Williams, who has money, who has access, but still was on, you know, and on top, what was it? Diddy's ex-wife as well? I forget her name. I forget her name real quick. Diddy's ex-wife. She actually died, and she has money. She has access.
Yeah,
but
and that's what Black woman. And that's what I'm saying. We was taught that, right? We were taught a lot. We were taught that once we get this money, once we get this education, we'll have everything that we need, right? And we won't have to. And it's sad, because why did I adopt that? Why did I adopt the ideology that if I was more educated and if I had more money, that I wouldn't be treated beneath me, and it was okay to still treat all them other people like that? Why did I even adopt that ideology? Number one. Number two, the shit ain't even true. Because, like you just said, all of those issues. And the doctor, Serena Williams, there has been many people of high levels of education who have died, women, after birth, because they were not believed. And so this issue is bigger than social class. It is race. It is race related, and it is other factors besides just wealth. And so what we were looking at was withering theory, was the fact that our age, our body, like our internal physiological body, is older based on the racism and the structure that we have to deal with and endure. We're older. And it also paired that with the fact that people don't believe you.
Facts.
My patient, the same patient with the kidney insufficiency, she came in, I remember, because she had came to the doctor a few times. She had complained of pain in her leg. Right. She complained of pain in her leg. And the doctor was trying to send her home. And she was like, this is not right. Could you just do what's so fucked up? What's so crazy to me is, if you get taught in medicine or Western medicine at all, whenever somebody gives you symptoms of like pain, warmth, swelling, you do a fucking Doppler, which is an ultrasound of your leg to make sure you don't have a blood clot, because that's just like what you're taught to do. And instead of him doing it, he was like, no, you don't need it. I think you're okay. And she's like, no, something is wrong. Like, this is not right. And she had to basically damn near cry to get him to do it. And do you know what he said once he found out that she had a DVT, which is a blood clot, a deep venous thrombosis? He said, oh, you were right. Like, jokingly.
Let me tell you something real quick, because I actually went to the hospital about a year ago, right? And the only reason why I went, because I don't like going, and I guess that's part of that stigma for Black people, right? To go to the hospital and do all this stuff, but I still want to take care of my health. So the only reason I was going is because I knew it was something wrong. I'm driving home from work, and I don't know if I felt faint or something. I forget how it happened, but as soon as I got home, I was speaking to my parents on the phone, and they was like, just go to the hospital, you'll be fine. Like, just go ahead, take the ambulance and everything. Had them come. They checked me. I was like, oh, well, we really don't know, but if you want to go to the hospital, we can. I thought about driving myself instead of getting into that truck, but I was like, forget it. I'll just go. When I get there, like I said, I'm being wheeled in on the cart from the ambulance. They had me in the hallway a couple hours before even seeing me. So I was still sitting on the stretcher in the hallway, just waiting.
So as soon as they got to me, they're like, oh, okay, well, let's go ahead and take the numbers, like getting my information, seeing who I was and all this other stuff. I'm like, all right, cool. Maybe I'm about to go to a hospital room or whatever it is. Like, just take me to a bed at this point. No, even after that, I'm still waiting. I'm still waiting the hallway. Once they get me out of the hallway, they put me in the waiting room. I'm like, why am I in the waiting room waiting even more hours if I came in on the truck that's supposed to get me immediately serviced, right?
Exactly.
Even then,
Exactly.
the reason why I went in there is because of my heart. I have, in my family, I have, what is it called? Heart failure, early heart failure. My father had an issue with his heart, and that was in his early, 40s, mid 40s to 50s. Heart had a whole thing going on. We were in St. Louis. He had to go to the hospital. He was in the hospital for it seemed like weeks or whatever. And he's been down for like months. It was early heart failure. So if something's going wrong with my heart,
Currently,
immediately. No, this was
currently,
he still has some
Okay.
issues. He still has some
Right.
issues, but this was back when I was a sophomore in college. So around that time when I left, went to St. Louis and came back, that's when that kind of happened, right? So with that being said, last year when all this happened and me having that in my family, especially it was a direct link because of my father, I'm like, I'm in my early 20s. Y'all need to go ahead and figure this out, because if that's happening to him in his 40s to 50s, I need to get checked out now. They just figured, oh, well, you'll be fine. You look okay. I didn't get scanned. I didn't get anything.
They didn't give you an EKG?
They didn't give me anything until 4 hours
They
later.
And you said you
I
had
was
chest
in
pain?
there. I was in, yes, chest pains. I was in there for
You
about
said
4
you had
hours.
chest pain and they
I
told you
had
4
chest
hours
pains.
later?
I had chest pains. So when they
What?
finally went on and got me a scan, like I said, this was 4 hours later when I'm sitting here. I'm sitting here going off. My auntie came down. She was about 45 minutes away and everything. She's a nurse. And I'm just trying to figure out what the fuck is the issue. Because if I
For
said I have chest pains, I need to be
That's not
going to be
nothing that
seen.
you wait on.
Exactly. So with that being said, I'm sitting there asking the nurse at the front desk, oh yeah, it'll be a minute. Oh yeah, it'll be a minute. It's other people in the room. They're taking everybody else before me. So when they finally get me, I'm in the room. The first thing the doctor says, oh, well, it looks like you don't usually go to the doctor. You seem pretty healthy. You can do that by looking at me? Really?
Right.
Like, I've been in here. I had to go off on her. Like, why the hell
are you talking about?
Exactly. So I'm going off on, oh, you must not have a degree for real, because why the hell would I be here if I didn't have an issue? That's the first thing. Second thing is, they didn't have anything for me there. Oh, we can't check that right now. But if you come back, I said, why the hell would I come back here to get checked out again if you don't even got the shit for me? If you don't have the tools necessary that you just told me come out your mouth, 2 seconds later tell me to make an appointment to come back. Why the fuck would I come back? You had me waiting in the waiting room for 4 hours, and 2 of those hours I was in the hallway still on a stretcher, on a fucking stretcher. And all y'all could do was get my information so you could actually send me the bill.
Exactly.
But all the beds you're talking about ain't no beds. I'm looking at the fucking beds. Ain't nobody in there. You have rooms. So the next excuse, oh, we don't have enough doctors. We don't have enough staff right now. Fuck all that bullshit. Y'all could have me in there already. Yes, all of that. For heart pains. If I have heart failure, early heart failure in my family, my father, my direct link, my motherfucking sperm donor, okay? And I have heart pains, that's an issue. I could care less if I'm 20 something, because a lot of times, I swear, a lot of times we hear when you at this certain age bracket, you're in your 20s, your teens or whatever, you're looked at as, okay, we could push you to the side and just take care of the elderly, and we take care of the babies first. And what they do, they took care of the elderly first. But it also depends on what your symptoms are and what your past history is as well.
Yeah, you still have to go based on the patient acuity and needs. And chest pain, they could have quickly put an EKG on you. The EKG, it wouldn't have shown how, like, well, they could have did an EKG, and it could have showed abnormal function, but they would have had to do another ultrasound of your heart to see if it was heart failure.
They could have did a lot, but they did not even see me. That's my issue. They did not see me, and I came in with the paramedics and everything. They sat next to me for a second before they even left. And I'm just like, why the fuck am I on the stretcher still in the hallway waiting? You know how fucked up that is in general? If I really, like, even after all of that, by the time that 4 hours was up, I'm back to my regular self. So now all of a sudden, oh, well, you're fine. Now you can actually sit there and say, oh, you're fine now. Well, fucking yeah, okay. Look, I feel better now because guess what? I've been sitting here. I could have sat in my own fucking room in my own house for that. I could have been okay like that if that was the case. But me knowing that it's something wrong, especially how my heart was feeling, I'm just like, okay, you know what? Let me go ahead and take care of it. Let me see if I could do something about it. But that discourages people like me to going to the doctor because we are not being seen, we are not being heard, and it's an issue. Because if we have an experience like that, like I did, where I'm not getting the proper treatment, the proper care, then it couldn't do anything apparently for me. So it was no point, but you're still sending a doctor's bill. Why the fuck would we go to the doctor if we don't have anybody fighting for us, one? And two, if nothing's going to be done. So yeah, sometimes it is going to be a situation where we're sitting back and like, you know what? That doctor ain't going to do shit for me. It's very valid and it's very real. Like I can understand why, for instance, a lot of Black men, they don't go to the doctor, or a lot of men in general don't go to the doctor unless they are married and the wife is pushing them to go. But you have to look at every avenue of that, of why they're not going, why they don't feel like they're not going to get serviced, because they're not. A lot of them, a good percentage of them are not. So what can we do as health providers and everything else just to see us, just for them to look and say, okay, you're a person too, you're a human too, because I'm pretty sure even in your studies, you probably had some situations where you're looking at the medical books. It's all white folks probably. I'm just making an assumption. If you doing something on white people, it's an assumption. But for Black people, it's always they'll be okay. Because it has to be learned somewhere. If you are in the medical, it has to be learned somewhere. Everybody cannot just go through this and just be like, it is what it is. I don't know, bro. I just got hot.
Yeah. Yeah, I'm sorry you went through that. Were you able to go and get an echocardiogram done?
I didn't
did you
go
ever make an appointment?
I didn't go.
No, I'm not talking about there.
No, I'm saying I didn't go back to there or anywhere. Like I never got it taken care of. I never got it looked at. They told me like years ago, heart murmur, but that's about it. But other than that, like never even checked it back out because I was that upset. I was that mad, and I did not want to have another medical bill just to say, hey, you came in here, but here's $1,200 on your bill just to pay this. To pay what? You didn't do anything. You didn't look at me. The nurse had a stank attitude and everything. It was a lot. But anyway, I know that
I think you I ain't trying to cut you off, but I think you should go to your primary. At least you can go to a primary, and then they can refer you to a cardiologist. That way you can make an appointment, and you can ask because of your history if you can have an EKG done and an echo done because of your or at least an EKG done to see if you have any abnormal rhythms. And then also to see if they want to do an echo to check for heart failure because of your history.
Yeah,
I know that like the experience was terrifying. I'm just saying that if you make the appointment, you know that you'll be seen.
Yeah.
It doesn't take away, what occurred though.
Yeah, I do need to do all of that. Like I have a primary care doctor and she's actually a Black woman, but she's out in the suburbs. I'm not currently there right now, so it's kind of hard for me to actually get back and forth because
the suburbs, like she out here or out there where you live?
No, out there. She's out there.
Oh, okay.
Yeah, so I've had her for a while now, and I have to just make another appointment with her because at this point, I'm trying to make anything that I do, any doctors or whatever, they're going to be Black. Off rip.
100%. Black women, I'm not even
Black women. Oh yeah.
Black men are okay too sometimes, but Black women.
Yeah.
And it's also something about older Black people. Even my dentist was a Black woman, and I'm not going back. She had so many assumptions. I had cavities in my mouth, but I'm 27. These were the same cavities that I had in my mouth when I was 16. I had got some of them filled, and then I didn't like the needle. And so I never went back to get the others filled. She thought that these were all like new cavities. These were the same cavities. I did acquire a hole in my tooth. That was new. But she just kept saying like, stop eating all that candy. And girl, I don't even eat candy. Like she just was like, and I eat it every now. It's very rare that I eat candy. If I eat anything, chocolate, but it's not no everyday snack, no nothing. And she also said the same thing about my son. And my son, you know, while he's here with me, there's no juice. The only candy he has are candy bags from birthday parties. And he has one from like, not even lying, like August, July. Like I let him get one piece every now and then. Like, so all of these assumptions, yeah, he has cavities. It's probably because they were up at the top of his mouth in the back, and we were like forgetting to go all the way back there. Like we was getting like the bottom row, the top row, and everything, but not like all the way back there. And that was just my mistake. And when he leaves my house, he does get candy from other people, but don't make assumptions like I'm just feeding my baby all this candy. You didn't even ask. So I think, yeah, Black people, but it's something about respectability politics for Black people for me. And also like, if I gotta vibe with you, you know what I'm saying? Like if I feel like you judgmental, you know, and you know, I don't want your ass neither. So
that's true. I have a therapist, she's a Black woman too, so I try to keep everything as Black as possible. And a lot of them are either middle-aged or a millennial type of age.
And I would love that. And if they was queer, that would be a plus too.
Of course.
Because it'll be perfect. Yes, go ahead, give me a queer Black young person. And they don't have to be too young, but
right.
And if they older, they just need to understand
they have to be
my identities, and they don't need, I can't deal with no shit, no respectability shit. I ain't got time for that. And I don't want no what the fuck was his name? No Booker T watch their ass motherfuckers. No, the motherfuckers that be like, oh, we just gotta work hard and blah blah blah, and
you know
it'll be stop acting like all this shit don't exist right here, and all we finna do is work hard. Fuck that. Fuck these people.
Well, let's go ahead and wrap up. What for our last question, what is something that you would advise us as future patients, just people in general, to do to take better care of their health and mental state and things of that nature?
So for a mental state, I would definitely say get yourself a routine, get yourself a daily routine. If it's journaling, if it's working out, if it's drinking water, if it's lighting a candle, if it's listening to music, somewhere where you're at peace and your child or your children can be with you, or they can be not with you. Whatever it is, for me, my son can't be with me. I need to be in my office or somewhere in my house, journaling, listening to like neo soul or alternative R&B or some Black ass radical shit, maybe some chanting. And I need some aromatherapy, some incense. I need some like a lot of energy. So for mental health, just get yourself a routine, have a place of peace in your mind and in your home, anywhere that can be, you know, if you don't have access to that, in your head, you know. In your head is the most important place. As far as a patient, I highly recommend, you know, patients asking questions and writing those questions down. And if you become a person who has a disease, learn about it. And when they start to prescribe you medications, learn about your medications, learn about the side effects, learn about alternatives to medications, right? And so as a nurse practitioner, I'm taught Western medicine. That's how I'm taught. I'm taught that way, right? Would I take all of these medicines if I don't need to? Hell no, because they all have side effects. And I'm not saying that to debunk Western medicine. What I'm saying is that medications affect systems, multiple systems, right? So much so that they don't always target one thing, right? If I give you a beta blocker, I'm targeting the adrenergic system. That's not just your heart, right? That's more than just your heart. Even though I'm giving it to you for high blood pressure, it's going to affect other things because it affects a system and the side effects, right? And so what I always tell my patients is, if we can prevent disease before it occurs, I would love that. If we could get the disease where it starts, and we can backtrack and we can make it better, we can do that. When you get to where you have all of these medications, there's no wonder that you're going to have side effects, right? You just are. And it's, when it gets to that point, it's hard to control. And I'm not talking about Black people right now, I'm just talking about people in general. A lot of people get angry and say, oh, the doctor prescribed me this medication, and then now I have another medication for the side effects. Yeah, because medications work on a system that can be hormonal, and they, meaning they affect multiple. The hormones don't just affect one thing, right? It's not just going to make one eye tear. Whatever it does, it's going to affect a plethora of things. And sometimes that plethora of things is not even what you expect, right? A medication that was actually Viagra, it wasn't created to be what it's used for. But that's what the side effect was, right? It increased blood flow. That's what it did. But that's not what we weren't trying to increase blood flow to your penis.
Right.
And so you just have to understand, to educate ourselves and as much as possible, as much as access allows, trying to have access to more natural things, right? And understand that herbs and all of those things, they have side effects too. Right. You know, don't just be taking some shit and not looking it up. Whatever you do, make sure you educate yourself. I'm a firm believer of preventative health. Preventative health is so important. Preventative anything, right? Preventative methods for mental health, preventative methods to prevent rape culture, to counter all preventative everything is life, right? And so when you get to the point where you need medicine, we're gonna have to keep trying to fix side effects if you have them, right? And even if you don't know you have them, sometimes drugs can cause, things that you don't know is happening. For instance, kidney damage. Lasix, we give that for heart failure. We give it to pull fluid off. It damages your kidneys. Antibiotics can damage your kidneys. If they're given an IV, if the Lasix is given IV. And so my biggest thing for patients, what I always tell them is, if you don't know, ask questions, try to educate yourself, preventative health, research. And I'm not one of those people who say, oh, I hate Western medicine, because I understand that we need it. Because sometimes you get to it where you can't, that shit not gonna work, right? And it may work once we, get it a little bit more, manageable. But sometimes you need it, So that's what the advice that I would give. Come ready, like, if you have questions, write them down, keep them. When you have medication, keep up with your meds, because that's the best way to manage your health. Understand what you're doing, because say if you have hypertension and you're getting better, you can ask, hey, look, it looks like I'm doing better with my food, my sodium intake. I'm taking these, I'm eating beets, I'm taking nitric oxide, and my blood pressure getting better. Can we see if I can take one medication away? Because you're an advocate for yourself. If you don't advocate for yourself, 9 times out of 10, nobody else will.
And
so just
advocating
getting that
for
knowledge.
yourself, real quick, can you actually ask for another nurse, another doctor, if you feel like they are not benefiting you to the best of their ability?
You definitely can. You definitely can. So if a patient says they didn't want me as their nurse, usually I would have to tell my charge nurse, and the charge nurse will have to speak to the patient and see what the issue is, and see if they can figure out, if there's anything that we can do to change. And if not, we'll have to switch patients. I will have to get another patient. As far as physicians, you can. It's just, you can. You always can. That's the
so you're not obligated to just
not saying that it won't be difficult. I don't know
right,
how they're gonna respond, but you can always ask for a different physician, as long as there's one available that's at the hospital. There should be another attending. At nighttime, there's like one house doctor, right? You can't ask for another house doctor because there's only one house doctor in the house, except for the emergency room house doctor. Right. Most of the time, depending on what the size of the hospital. But yeah, as far as a different attending, you definitely can. You definitely can say, I do not want you as my physician.
Right.
I am requesting another physician. So whoever I need to speak to, and it's usually the nursing manager because they have to coordinate that, the case manager. Yeah, you can.
So in other words, don't feel obligated that you have to stay with the same staff if necessary.
Mm-hmm.
And you can also be transferred from them as well to another hospital if unnecessary. So just like Kitty said, like you have to advocate for yourself at the end of the day. Do your research. Shoot, and more prayers out to y'all. But let's go ahead and wrap this up. Thank you so much for joining me today. I really appreciate this. I learned a lot. I know we had some emotional times. Just
I'm emotional.
No, both of us. Let's be real. But that's okay. Like, let all that out because that's part of taking care of your mental health as well. Don't bottle everything in. So again, I appreciate you. Thank you so much, and thank you all for listening and tuning in for another episode this week. And you will hear from me next week.
Be sure to download, like, and subscribe each time a new episode is dropped. Follow the podcast on Instagram at Barely Adulting Pod and share with friends and family. This is your host, T. Marie, signing off. Until next week, thanks for tuning in.